The intent of this video series is to introduce students and novice occupational therapy professionals to the current views of professional and clinical reasoning. The videos are meant to stimulate follow-up questioning in order to dig deeper into the understanding of the concepts presented. We will be using modified and expanded definitions related to the aspects or modes of clinical and professional reasoning as provided by Schell and Schell from 2008 and Unsworth from 2011. This video will introduce narrative reasoning concepts in preparation for classroom or professional discussion. According to Schell and Schell, narrative reasoning is the process through which therapists make sense of people's particular circumstances. They prospectively imagine the effects of illness, disability, or occupational performance problems on their daily lives, and they create a collaborative story that is enacted with clients and families through intervention. Our client's narrative establishes the meaning of the client's condition in relation to their life story. We take into consideration the person's past, present, and future contexts. This is where, as a clinician, you obtain and reflect on the person's occupational profile and determine how it has changed due to their current circumstances. This is a crucial first step in thinking about and determining how we will collaborate with our clientele during our interactions with them along their personal journey. It's important to remember that the narrative belongs to the client you are working with. Although we have our own perspective on how their circumstances are affecting their narrative, we must ensure that we view it from the perspective of the client. We need to know, understand, and give due consideration to their preferences and their motivations. Finally, consideration of your client's narrative is pervasive throughout each of the modes of professional and clinical reasoning. We must learn their perspective on their condition or situation, as this will greatly determine how we use other modes of professional clinical reasoning in our practice. In this new chapter of their narrative, we need to discover if they are in a time and place where they are either an agent of change in their personal story, or do they view themselves as a victim of their circumstances? How do you proceed with a client who sees themselves in a victimic role in their personal life story? Can the client see the connection between their occupational therapy interventions and their narrative? How do you facilitate the next chapters of their personal narrative? I hope this introduction to narrative reasoning helps you formulate some follow-up questions for deeper discussions in class or with other professionals who have already progressed along the novice to expert maze.